Hello, everyone. My name is Dr. Kimberly. Thank you so much for joining our webinar, our first webinar today. I am going to try to make it just 45 minutes long, and we'll leave the last 15 minutes for any questions that you may have. So let's move along. I know everybody is checking in. Some of you are on time, some may come a little late. Thank you so much again. So in this webinar, I will be talking about the subject that all of you care about, and that is why you are here. And that subject is acne. This webinar is for all age groups. If you are a preteen from about 9 to 12 years old, I thank you for being here. It is good that you signed up because if I can prevent one person from suffering from acne, I feel successful. I believe if you start early, you will be able to prevent acne. This is the age I would like to start everyone on skincare. Skincare is taking care of your skin to help maintain your skin looking good. If you already have acne, even if you're an adult, it is never too late. I am here to help you understand why you have acne and what you need to do to get rid of acne. Okay, so let's move along. Our webinar today will be divided into 3 parts. The first part will talk about skin hygiene, when we should start taking care of our skin, do hormones play a role, and should we blame it on the hormones? What do you think? Then the second part, why do we have acne and why some of the products bought at our local drugstores or online or the medications that your doctors have prescribed to you don't get rid of acne. Why do you have even more acne, even more than before you started treating? Then the third part is about Apogee. That is the name of our product line. It's called Clear Skin by Apogee. What is the Apogee method of treating acne, and how can I, Dr. Kimberly, help you? The last part will be a fun quiz, which we will email to you. If you get 100% on your quiz, you will receive a prize. It'll be a surprise coming from me. I hope you all get 100%. If you listen to the entire webinar, feel free to take notes. You could use your notes during the quiz, and you will be able to get 100%. So our first topic is about skin hygiene. What is skin hygiene? Well, to me, it is like brushing your teeth. Skin hygiene is what we should do to keep up with our skin, to keep our skin looking good and clean. Something we should do in the morning, and so that is when we get up in the morning and at night before going to bed, just like brushing our teeth. We have 32 teeth, yet we brush and we spend time in the morning and at night. We have 20,000 pores, but do we do anything to maintain, to keep them clean? The skin regimen consists of cleanser, a toner, a sun protection. And we got to make sure that it is an appropriate one for our skin condition because each person's skin is different. The tolerance is different. The type of skin is different. The sensitivity is different. Many of you have used medications or many other products in attempt to treat acne, causing your skin to be super sensitive or slightly sensitive. So that's what I'm talking about. So if your skin has changed from how it used to be, then our skin regimen need to match our skin type, okay? The current condition, not what it used to be. So here's the thing about skin. When you wash, your pores will open up. That's the reaction of the pores. Therefore, you must use a toner to close your pores after you wash. So just as simple as that. So when your pores open up, you clean. After that cleansing procedure, you want to use the toner. The toner is also important to help balance the pH on your skin in order to keep bacteria away. Just remember that. I don't want to spend too much time on skin hygiene, but just remember every single skin regimen has a cleanser and a toner because researchers know skin needs to have a certain pH in order to keep the bacteria away. And so that is the step we gotta do after we clean. Remember, this step is very important to keep your pores from getting enlarged as well. So why do we worry about skin hygiene? Why do I start with that? I believe, just like your teeth, if you come to me, all 32 teeth have cavities, I'm going to put a big question mark and say, what did you do? How have you been taking care of your teeth? That would be the first thing I ask. But even if you have 1 or 2 cavities, I'm probably going to remind you how to brush in the proper way to brush. So when it comes to our skin, we sometimes neglect to do anything for our skin. Yet we expect our skin to always look good at all ages. So the important about skin hygiene is that I want to make sure my skin look good later on, or actually all the time. Not just when I grow up, but especially when you grow up. I believe as a teenager, you do care about your skin. You begin to explore and understand more about your body. So I do believe you begin to focus more on your looks and on your skin, hopefully. However, many of you wait until you have acne, and then you start focusing on your acne. But I want you today to think about the first step, skin hygiene. Keeping your skin clean, even if you have acne today. You want to make sure you take notes. You want to make sure you take my quiz at the end and ace it, okay? So why should we worry about skin hygiene? So basically, when it comes to your skin, you started out with tight pores, and as babies, until you get to preteen or teen years, you begin to have changes in your hormones. These hormones are responsible for the changes in your body. We're not going to spend too much time on the hormones, but we will talk about how those hormones affect your skin. Those hormones are responsible for oil production. You begin to secrete oil. And because those hormones stimulate the sebaceous glands, and we have many sebaceous glands along the T-zone and in other areas on our face. When you don't do the routine skin hygiene, you will start seeing blackheads and then eventually whiteheads. Blackheads are the ones with the black pepper-like heads. So that's why we call them blackheads. And they usually grow along your forehead, down your nose, and your chin. What are blackheads? Blackheads are simply dirt, debris from the environment mixed with oil, the oil that the sebaceous glands have produced that sit on your face because you didn't follow any skin hygiene. And they start going into your pores. Just as they say, stagnant water will seep into the ground eventually. These will accumulate over time to form blackheads. And they sometimes can be as hard as grains of rice. So tonight, look into the mirror and see how many of those blackheads you have. Many of those will turn into whiteheads. And whiteheads are the ones that you really care about. But I care about blackheads as well as whiteheads. If I were you, I would care about both. Why? Because to me, blackheads are the precursors. They bring whiteheads, so I'm going to care. So if I could prevent blackheads, I will be able to prevent whiteheads. Okay? So sometimes we don't see blackheads unless we get really close, unless we have a lot. But we are able to see whiteheads quite clearly because they are red and they are visible. And that's the reason we don't like them, because we can see them. Many others can see them as well. But where do they come from? As I said, they came from blackheads. So from us not washing and from us not taking care of our skin properly. And what does that mean when we talk about taking care properly? Let's stop there and write this down. You want to clean, a proper cleansing. You want to spend a little bit of time massaging the cleanser into your skin. Spend about a few minutes and make sure you get the crevices around the nose, the mouth, and the jaw lines. So you want to kind of massage your cleanser in. Okay. And then after you wash, you want to repeat twice. And if you have makeup, you want to do it 3 times. Deep cleansing is usually twice. Okay. And if you have makeup, you want to do it at 1 additional time. That's only fair. And then at night, so that's for nighttime, you want to do the deep cleansing 2 to 3 times. And then in the morning, you want to repeat. So in the morning, you can do it once because you really haven't been doing much. You're just trying to get rid of the oil that's been sitting on your skin while you're sleeping. And so after you cleanse is the step, as I said earlier, is the toner. So you need to balance the pH. You got to use the toner, and then after you leave the toner on, and then you want to use the sun protection. Now you're ready to go to school, or you're ready to go out. Okay. So I believe that we should always use the sun protection, no matter if we're going out or not. Okay. So even if you're staying home, you want to use those 3 steps, and those are the basic 3 steps for preteens. And if you start secreting oil, and when it comes to the body, it's hard to say exactly what age. So sometimes it's 10 or 11, and sometimes my youngest patient is 9. So sometimes 9 years old. It really depends on your body, and it varies. And so if you start seeing the T-zone area is oily, shiny, then you want to add on the oil control cream, the Apogee Clear Skin Oil Control Cream to balance that oil. And the pores, to keep the pores clean, we use the pore refining balm. I'm going to go over these steps later on in detail. So right now, I'm going to say that and leave it at that. So for the second part, I would like to talk about why do we have acne and why some of the products bought at our local stores, drugstores, or online, or the medications that our doctors have prescribed don't help get rid of acne. And why do we sometimes we have even more than we started out with? What's happening? When you have acne, many of you start going online to order. You go to your nearest pharmacy to purchase acne medications such as Neutrogena, Clean and Clear, Acne Free, Proactive. Those are very familiar to me because many of you have come and have listed those products as the ones that you've been using prior to coming. And many of you have been there, done that, gone to the doctor, and quite a few have been on Accutane, orally, and oral medications such as antibiotics, doxycycline, tetracycline, etc. Okay, so today we're going to learn about some of the ingredients we want to avoid. All those products that I mentioned, over-the-counter products, have these ingredients in common. Benzoyl peroxide, salicylic acid, retinol, or vitamin A. Most of the prescriptive medications are much harsher than the over-the-counter. So what happens and how do they treat? So the way they treat acne is that they all dry up your skin to heal your acne. Do you really think that that's how you get rid of acne? What is acne? Acne, like I said, started out with blackheads, dirt, debris, and then they become whitehead. That's bacteria. Why do you want to heal over the bacteria and keep them inside? So when your skin dries, these medications think that, or these ingredients or these brands think that once you heal everything, once you dry up everything and you heal over your wound, then your wound will heal or your acne will heal. Well, I'm sure many of you have been there, done that, and you can attest to the fact that your acne hasn't gone anywhere. They just pop up again, okay, probably over a month or even less than a month. Initially, you will find that these ingredients will help because when you dry up, they kind of appear like your acne's gone. But then when they pop up, then you know they're not gone. Here they are again. They're knocking on the door again. So you kind of know that they're there, back again. And so basically, you're back to having acne. And what else do you have on top of acne? So after having used all those ingredients, all those brands, all those medications, you have a worse problem on your hands because now your skin is dry, irritated, and sensitive. So you have changed the condition of your skin. And that's why I said earlier, if you started out with healthy skin and now after using all those medications and your skin condition has changed, you got to make sure you use the right products to take care of that new sensitive skin. Otherwise, you are going to cause more problems. And I'm going to briefly mention that those problems will be more redness, more dryness, more irritation. Later on, you're going to have spots because you have hyperpigmentation because your skin is now quite sensitive. Wherever you have acne in those areas that are damaged, it leaves a mark, it leaves a spot. Some of you might call those scars, but they're called hyperpigmentation. And then later on in life, you are going to have early aging. We'll talk about that a little bit more later. So I want you to take a look at the skin, a picture of this person's skin when it's red like this, when it's rare like this. Is it fun? This is when you started out with a little problem. And then when you don't treat the problem correctly, you have a bigger problem. You have a lot of redness. You feel irritated. You have to feel bad for this person. Not only does she look bad, but she probably feels bad. So we feel embarrassed because our skin looks red. We look flushed, especially when we go outdoors or during our physical education hour, right? So our skin is damaged. Now what do we do? Okay, so we want to stay away from those ingredients. Again, those ingredients are benzoyl peroxide, salicylic acid, retinol, or vitamin A. Sometimes they may be using, they change the wording a little bit, but if you look at the word and it looks like it has the word benzoyl peroxide or salicylic acid or retinol, but it might be using something else, play on word, you know that you want to stay away from it. Okay, so let's go back to the reason why these products will not help you. These ingredients will overly dry you, causing your body to respond. And how does it respond? It responds negatively by producing more oil, because when you are over drying your body, remember your face is part of your body, you are actually stimulating the sebaceous glands. Okay, and so the sebaceous glands will be stimulated to do what? To produce more oil. So you're kind of like, okay, I'm oily. I want to get rid of oil. I don't want more oil, but now I have more. So what happens when you have more? When you have more acne. Okay, so that's how your body responds to those ingredients. You will definitely see initially acne goes away, but until your body starts having a little chance to respond, it actually is your body is quite sophisticated, but it does take time. It's not going to overreact. It's not going to, suddenly react. It will gradually react. And so eventually those sebaceous glands are stimulated. You end up with more oil. Again, you're back with acne. Okay, so let's talk about how Apogee can help you. What is the Apogee's method of treating acne, and how can I help you? The Apogee's method of treating acne is one that I have researched and created simply because with my background in medical and pharmacology, I saw how those medications cannot treat and how our skin ends up damaged by them. And what I have to do to help my clients, my patients, overcome those damages. And then eventually I had to produce or develop a line of skincare that will treat acne at the root cause without damaging your skin. As I said earlier, when we use those medications to treat our skin, we will only have hyperpigmentation in later years. Our skin will easily get dark spots, and we will eventually age quickly, age faster than we should. And Apogee's method to balance, Apogee's method is that it balances the oil on your skin. Not take them all out. It will balance. We'll keep some because every skin needs some moisture. Every skin needs some oil. And also, we don't want to stimulate the sebaceous glands. So our method is not to over dry you because, as I said earlier, over dryness will only stimulate the sebaceous glands to produce more oil. And we don't want to do that. I care about skin health. I want you to have a healthy lifestyle. I want you to be able to enjoy the outdoors. So don't use any ingredients that are harsh. Don't use the method of treating acne that is, like I said, over drying your skin and causing you to be irritated and red and flushed or rare or peel. Apogee Pore Refining Balm is what I invented to clean out the pores. If they're not clean, if they are clogged, then you have clogged them with blackheads. If you have blackheads, you will have whiteheads. And if they are already clean because you came to me just in time as a preteen, it will just maintain the pores clean. Keep them clean. You don't have to wait until you have cavities to come to me, right? So you don't want to be treating your skin. You want to maintain. You want to start with just the basic skincare regimen as soon as possible. Anyone with more than 5 acne, or if you have whiteheads, remember the pussy type and the red type, the kind that are oozy. You want to use Retinex, which is our vitamin A herbal, which is retinol. It is not retin-A and no chemicals. We don't use any chemicals in our products. And all of our products are good for your skin and will not eat away or peel away your skin like others. So if you are 9 to 11 years old, you want to use our Gentle Cleanser, Gentle Tonic, oil-free sunscreen to protect your skin. And if you are 12, 13, or over, and you already start seeing oil in the T-zone, but you don't have any whiteheads, the pussy kind, then you want to add the oil control cream. You want to add the pore refining balm. If you are at any age and you have oil and you have blackheads, on top of blackheads you have whiteheads, then you want to add Retinex. Okay. Now if you're kind of confused or you're not sure, I urge that. What you want to do is you want to call us at 1-888-337-7264 for a consultation. What I'm going to do right now is I am going to set the clock at 15 minutes. During this 15 minutes, I will be explaining a few other things, but I'm going to set this clock for you. If you would like to purchase any of the products, you could click, and this clock is to help you get a free product. Okay, so I'm going to take a few questions right now. That concludes the presentation part. I would love to answer any questions, and if I don't get to you, please rest assured that I will email you my answers or I will call you. Okay, so I see the first question coming in. The question is, I have acne for a long time. Now I have scars. What do I do? Okay, dear, if you haven't treated your acne properly, I believe in treating scars as well, but I believe we need to treat our acne and make sure we treat our acne at its root cause. That way we don't waste money treating scars when we haven't treated our acne. And then when your acne is gone for sure, then we can talk about skin aesthetics. When I talk about skin aesthetics, I'm talking about the dark spots, the redness, scars. Some of you may have pitted scars. Some of you may have just hyperpigmentation, dark spots. Sometimes those dark spots can really be bothersome. They appear as if you have a ton of acne on your face. Many of you have those dark spots because you've used harsh ingredients before. when you use harsh ingredients, you know they thin out your skin, causing you to easily accumulate those dark spots. Whenever you have an acne, it leaves a mark. And that mark used to go away. But after using those harsh ingredients, those dark spots don't go away because now your skin condition has changed. Okay, I do see another question. And this is a good question. If I have redness and I am embarrassed by it, what can I do to reduce the flushing and the irritation like you mentioned? Thank you for asking that question. I sure hope we could put a stop to all the rosacea, the redness, and the flushing and the irritation. Because, it's one thing suffering from acne. It's another suffering from the medications or the problems that the medications cause on top of the acne. So I would say, yes, our products will help you. Like I said, if you have a condition where your skin is red and irritated and it's peeling all the time, yet you are still oily. So many of you feel like, okay, yeah, I don't know anymore. I'm oily, but I feel dry as well. You are both. Once you've used all those harsh ingredients, you are both dry and oily. And I always say this to my patients. If you say that to a doctor, you say you're dry in the same place and you're oily in the very same place, that doctor may not believe you. Because how can you be oily and dry at the same time? But I believe you. I believe that could happen. Why? Because when you lost that protective layer, when you use those harsh ingredients, that protective layer is usually keeping your skin moist and keeping your skin cool. Well, now your skin is not moist anymore. So everybody needs moisture. Otherwise, we crack. Okay? And when you lose that layer, protective layer, you are going to feel flush because, there's nothing to keep your skin cool. So many of you, if you're not cooking, if you may be going out for PE, or you're just doing some outdoor activities, playing basketball, or simply in this weather, you are in the heat, or maybe your parents or your family turn on the heat because it's cold outside. It's cold inside too. Your body or your face cannot handle the heat. So remember that skin condition is caused by the harsh ingredients you've used. So let's not exacerbate. Let's not make it worse. We want to put a stop to it. We want to stop today and put those products aside. I don't want you to throw anything away at this point. I would just urge that you stop, put them aside until you believe in Apogee. When you switch to Apogee and you feel better, you are going to look better. Once you feel better, you kind of go, yeah, I don't have a need for these products anymore. Then you can throw away. So to answer your question, it is really important that you use the Apogee skincare line for sensitive skin, because it'll take care of the sensitivity. It'll take care of the symptoms like the dryness, the irritation, the peeling, the flushing. And I know those symptoms. They get worse and worse as time goes by, even if you stop using those ingredients. Thank you for your question. What is the next question? Yes, I see many of you. I apologize if I can't get to all of your questions, but rest assured, I will answer all of them. And one way or the other, I may answer via email. I may call you. I may have someone call you, but I will answer your questions. The next question is on oral antibiotics. What role do antibiotics play, and whether or not I should continue taking my doxycycline? Thank you for asking me that, because I barely touch on antibiotics, oral antibiotics, during my lecture. Antibiotics to me should not have a role in treating acne. And you know what? Many of you have been there, done that. I am sure you could attest to that. So, like I said, you own your own body. Really, you need to take charge. Because when you start seeing, and I know many of you have taken antibiotics after you've used a lot of over-the-counter medications, gave up on self-treating, you go to your doctor and you tell him, I want to treat acne, and so he gives you a prescription for more topical, stronger topical medications and oral antibiotics. And then when they don't work, you come back and you say, doctor, they initially worked and now they don't work anymore. Your doctor knows that too. But remember, antibiotics or medications are just a means for doctors to treat you. They don't invent these things. That's the wrong type of doctor. So for me as a researcher, I would research and invent or develop a product that I find fit that's not out there. But your medical doctors don't. But your medical doctors don't develop those products. So, when you take antibiotics, you're not really killing the bacteria. You're merely suppressing. So when you are suppressing, we call it bacteriostatic. They're not bactericidal. They don't kill the bacteria. Bacteriostatic is just suppressing the bacteria. Then the bacteria will be revived or proliferate again. They grow back again. This time they grow stronger, they become resistant, and so those antibiotics will not kill them anymore. So, as I said, antibiotics will initially reduce the amount of bacteria, but eventually they will grow back again and you will see your acne is back. Then you come back to the doctor and the doctor gives you another. So when you keep doing that, even if you take antibiotics like you're eating candies, you are not going to see your acne is not gone. It's only gone temporarily because you haven't really done much. I mean, you're not going to kill the bacteria. You want to kill them all. You don't want to be just suppressing, okay? So what I tell people is that when you use the Clear Skin, Apogee Clear Skin line, the pore refining really helps push out any blackheads. And those blackheads really start lurking at the top, and then we're able to self-extract. And if we can self-extract them, then they will die because those bacteria cannot be killed with antibiotics. They can be killed with just plain air. Get them out. They are anaerobic. They don't like air. Once you get them out, air will kill them. Okay? So researchers have recently found the type of bacteria that cause acne are called propionic bacteria. I call them P bacteria for short. And those bacteria actually just can't be killed by antibiotics. They can be simply killed by pushing them out. So how do you push them out if you don't see them? You use the pore refining and, of course, the whole regimen because they kind of all work together. The purpose is to clean out your pores. So I can't say it enough. If you have a skin problem, if you have acne and you have recurring acne, please look into treating your acne today at its root cause. I urge that you take the opportunity. What I'm going to do is set the clock at 15 minutes, like right now. Today we have a special and I'm going to set the clock at 15 minutes. For the next 15 minutes, for those who attend this webinar, if you or your parents would like to have the special, I am going to set the clock for 15 minutes. During this time, if you purchase our Apogee system, you will receive a free mud mask. This gift is $40. And what about the mud mask? What is that? Mud mask, the reason I give that is because it's so valuable. Mud mask will help absorb any oil and it will extract oil from the pores. So again, if you have blackheads and your blackheads mixed with the oil have clogged up your pores, then mud mask will help. So what you want to do is take the mud mask, use it every other day in the oily area. So if you are oily all over, then you would want to use a thin layer all over. If you're only oily in the T-zone, then you would apply a thin layer in the T-zone. When we say T-zone, that is the shape like a T on your forehead and down your nose and your chin. Don't forget your chin area. And leave it on for about 15 minutes and wash it off. Okay? I don't want you to use any scrubs. Really, and this is the reason I'm giving the mud mask. The scrubs will actually cause your skin to be will be too abrasive for your skin. Will scratch your skin, especially those of you who are young. We don't want to use the scrubs. Sometimes I know many of you have used the scrubs and you love the scrubs because you feel squeaky clean. But no, your skin is not like a frying pan. We want to make sure we want to take care of our skin and its condition. If you've used a lot of harsh ingredients like acne medications, you don't want to use any scrubs. Anything that are grainy, you don't want to apply on your face. And mud mask is really for all age groups. So I love that product because you can just 15 minutes. I feel really clean afterwards, especially after you wash it off. It feels very light and very clean. So to deep clean, I would recommend that you use mud mask maybe like for 15 minutes every other day while doing your homework or while you're cooking or while you're whatever you're doing. Even if you leave it on longer than 15 minutes, you're fine. Okay, 15 minutes is not an exact number. Okay, so I hope you enjoy the webinar today and take advantage of this special. I usually am not the one to give these specials, but I did request that our company give some kind of special during the webinar for those of you who are interested in treating. And so what they have given in addition, which I'm so happy that they are able to do this, basically if you want to purchase today, if you have acne, you will benefit from this special. So in addition, you will get the acne zap. If you have acne, you want to have the acne zap. I will include the acne zap for those of you who have whiteheads. So make sure you use the acne zap properly when you start seeing that whitehead beginning to form. You want to dab on it, use it at night, just a little dab. In the morning, you will see that if you cut it in time, your whitehead be gone within a few days. So again, this is the special during this webinar only. So please click that button so we know that you will be getting the special. And this is only for the next 15 minutes. So again, I'm going to show you some pictures. And while you're thinking and while you're clicking on the button, the timer is going, I want to talk about the different age groups. So when you are young and you're a preteen, like I said, it's not we're talking about the human body, so it's not an absolute. So when I say preteen, it could be, before your teens, and it could start at 9, 10, or 11, or 12. Your body is going through changes. You're beginning to see oil. And where does oil secrete? In the T-zone. That's where all your sebaceous glands are, mostly. Then later on, so if you take a look at that picture first. So the first picture you see there is someone who's young, who has acne right along the T-zone. You may not see acne on the ridge of the nose or around the nose unless you get up close, but you could see a lot of blackheads forming on the forehead. So that is very typical of preteen or early teen acne. And then for someone who, however, don't get me wrong, is that you don't have to be an adult to have adult acne, just like you may have adult acne at 15. So sometimes I see many clients who have acne full-blown acne at 15. And so here's the second picture. So a picture of someone who has a lot of acne at the age of 15. And it actually starting to spread. It's not along the T-zone anymore, but it is along the cheeks. And it's actually a bigger T than it used to be. So a lot of times your forehead might clear up, but then your acne is starting to migrate from below the eyes. And then the third picture here, as you could see, when you have a lot of acne and when your acne is out of control, then you're starting to see scars. You see enlarged pores. You don't even have to get up close. So those pores beginning to look like scars. And in adult acne actually appear maybe the lower half of the face. So like below the cheek area, the lower cheek, and then the jaw lines. Okay, so you may have acne like below your jaws, along your neck, but below your jaws, your jaw lines, and the lower half of your cheeks. So just when you think you got rid of acne, acne has migrated. So I urge that you treat acne at its root cause, get rid of your acne, maintain focus on getting a set of products that are appropriate for your skin. Stop using the harsh ingredients. Stop using medications, because you know medications don't work. And many of you have been there, done that. Many of you are about to take Accutane. You might want to speak to me before you do. Okay? So our number again is 1-888-337-7264. And please click on that button, because we only have a few minutes left for you to receive the special. Again, the special is, if you order today, you get the mud mask, and this is a free gift of $40. And then I also wanted them to give the acne zap, and that is important for those who have whiteheads. The acne zap is something you should always have by your side. So when you have a whitehead, you want to get rid quickly. You don't want them to become a big problem. So within the next few days, the whitehead will be gone, if not overnight. So if you cut it in time, the acne zap will just zap away that acne, and it'll be gone when you wake up. But if not, a few days is all it takes. And then when they're gone, they don't leave a mark. So again, thank you for being at this first webinar. I hope that you let your friends know, and your neighbors, your families know that you attended this webinar. And, if you could give them our phone number so that they could also sign up for our future webinar. Thank you, and I look forward to the next webinar. Thank you very much. If you have any more questions, you could also email me at drkimberly@kimberlyskin.net. Thank you.